Welcome to the We Talk Health podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is Dr. Cameron Micahel. He is a neurologist at West Tennessee Neuro, a new neurologist at West Tennessee Neuro. So we're certainly glad to have him in the area. And Dr. Micahel, welcome.
Well, thank you so much for having me.
Absolutely. So we're going to talk about migraines today. I said off mic that I've been fortunate enough to never have one, or if I have, I didn't realize it. I just thought it was a bad headache. So I know there are tons of people out there who suffer from these daily, and there are tons of people who haven't. So we're just going to talk about them, what kind of causes them, ways maybe to fix them or to get rid of them. And before we do that, I want to get to know you a little bit more. Sure. So tell me about yourself. Where are you from? Maybe where you did your schooling, what you like to do when you're not at work.
Sounds good. So did my medical school out in East Tennessee at Lincoln Memorial University as a DO school out there out in the mountains. And then I did my residency down in Birmingham at UAB Hospital.
Nice.
So did a 4-year residency there, and now I'll be starting West Tennessee Neuro next week, actually.
Awesome. That's fantastic. So what do you like to do when you're not working?
Well, my family and I really love hanging out with animals. We have 4 dogs, a cat.
Amazing. Some
ducks, planning on getting some farm animals. So we live down in South Jackson where there's a lot of farmland. So
no, I was going to say you have a zoo, basically. That's
exactly.
Awesome. Going to partner with the Alamo Safari Park.
Oh, yeah. Yeah, we've already been there.
Nice.
Yeah.
Well, cool. So like I said, we're going to talk about migraines. So let's just kind of dive into it. Can you give me just a definition of what a migraine is?
Sure. So the classical definition of a migraine is it's basically a unilateral, meaning one side or the other, like right or left on your head, pain that is pounding in nature, that can last anywhere from 4 hours to 72 hours.
Good Lord.
Yeah, and they can cause a lot of other symptoms, and there's some distinction of like the different types of migraines and things, but by and large, it's a pretty profound headache that can really knock you out. And people can have sensitivities to light, sound, and even become nauseous and throw up during these attacks.
Jeez. Is there like one specific thing, or I guess a multiple, that cause migraines?
So the science behind migraines it's really complex, firstly, and we still don't really exactly know what's going on. But looking at a broad picture of what causes a migraine in particular, it starts with some kind of trigger or something that starts a cascade of effects. And then from that trigger, you can have what's called cortical spreading depression, which is a fancy, scientific term. But basically what that means is there's a wave of discharges that occurs in the cortex of your brain, which is kind of the outside part of the brain, that works its way forward from the back and down into the brainstem, where you get some activation of the pain receptors, basically, that cause the pain sensation that you get from migraine.
Gotcha.
So it's a lot of molecular types of science going on, but at the end of the day, it seems to be that the molecules involved cause inflammation, pain, and the vessels to become engorged on the lining of your brain. And that's what's traditionally thought, at least in the last few years, as to what's causing the migraine.
Gotcha. So what are there different types? And if so, what are they called?
So there are different types of migraines in particular. So there's migraines that have an aura, which is some kind of a preceding symptom, something that gives you a warning of the actual attack that's to come. So a lot of people describe what's called a visual aura, and basically that's an artifact in your vision that you can kind of see, and just it looks weird. It's really hard to describe, but it's almost like you're looking through a prism in just one part of your vision.
Interesting.
Yeah. So some people get those, and those actually can be helpful in treating them because you have a warning sign to be able to treat them.
Sure.
There are those migraines that are without aura, and that's actually the most common kind. So I'll have patients that will have some kind of trigger that sends them down into the migraine pathology, but they don't even know that it's coming. It kind of hit them out of left field. And then you have different types of migraines that have like a brainstem aura or hemiplegic migraines, things like that. But that there's there's a lot of different kinds of headaches. And
Gotcha, yeah.
we're just kind of scraping the surface with just migraine alone. And that's actually a really important part of, going to see a neurologist to get that exact definition or the exact diagnosis so that you can treat it correctly.
Yeah, I'll be honest. I've heard several of my friends have had migraines, and they've said their aura is insert whatever they said. I didn't know what they meant by aura, however you say it, and I was like, that sounds a little hippie-ish, like kind of thing. But obviously, I'm learning here today, so I didn't know that it could affect your vision.
Yeah,
like it could.
And some people describe other things that give them a warning, like maybe they have excess fatigue or something like that. Maybe that's their warning sign. But usually, that's something you kind of figure out in clinic, and then each person has kind of an individualized, story with how their head pain progresses.
Lately, I know other people have been dealing with this, but my allergies have been murdering me. Is our allergies something that could cause?
Absolutely. So actually, identifying your triggers is a really important part of treating migraines because if you can avoid triggers, it obviously it'll help you avoid having migraines.
Sure.
Allergies is that's a big one. Sleep deprivation, too much sleep, too little sleep, dehydration, things like that. Those are all lack of exercise. All that kind of stuff can play into becoming a trigger. Smells, sounds, light. All those kinds of things can be triggers.
I didn't realize all of those things could potentially be triggers. Wow.
There's a lot.
What patient population typically gets migraines?
So migraines tend to affect, usually younger patients will be the patients that present with migraines, younger meaning in the 30s to 39. But I've had patients on both sides, pediatric to, geriatric that come in with first-time migraines. And so your typical migraine patient is going to be a younger female, but that does not mean that males don't get them. I myself suffer from migraines, and they tend to run in families. So if you've had if your mom or grandparents have had migraines, you may have a higher risk of having them. There's no clear genetic factor that has been identified at this time, but there's probably multiple genes that are involved in keeping this within the family. But up to 15% of the general population has migraines. And so, you may be suffering from migraines and not even realize it, kind of like you were saying. And, that's a good reason. Just bring that up with your primary care doctor. If you think you're having migraines, there's no harm in just asking about them.
Of course. I feel like that kind of goes for other facets of healthcare as well.
Absolutely.
So what is the prognosis for a migraine?
So prognosis is tough with migraines, and I think it's probably explained by the lack of a certain identifiable risk factor for them. But really, at the end of the day, it's a person-to-person story. So I would say most of my migraine patients kind of stay stable, but a lot of people end up having worsening or progression of their symptoms. And I have just as many people who have regression of their symptoms and actually things are improving. So there's no, unfortunately, there's no clear answer to that, but I think that's even more important to follow along with a neurologist to be able to kind of track you along and help you along that journey.
Yeah, absolutely. So are there certain ways to get rid of migraines, like maybe quickly, or is there more of like a strategy behind how to get rid of them?
So in my practice, I do have a strategy. There's basically two ways to treat them. Well, it's actually one way to treat them, but two different ways to approach that.
Okay.
So we have what are called abortive agents. So those are medications that you would take on the onset of a migraine. So if you know your trigger and you feel one coming on, you want to take this medicine right away so that you can try to stop the progression of the migraine. Actually, studies have shown that the sooner that you get the medication in you, the more effectively it's actually going to work in treating the migraine. And that's based on a lot of those molecular pathways and whatnot. But so an abortive agent, one that you may have heard of, maybe is Imitrex.
Yeah.
So that is a serotonin-based medication that helps to modulate some of those pain receptors in the brainstem, and it also kind of clamps down on some of the vessels. So there's a lot of different mechanisms to that, but overall it does the same thing, and it reduces some of those molecules that mediate pain and the migraine itself. Then
Okay.
the second strategy is what we call a prophylactic agent. And that is something that you would take every single day in order to help prevent the attacks, period.
Mm-hmm.
And so the idea being you reduce the frequency and the intensity of those attacks with this medication. One that I commonly use and patients typically will come to my clinic with already having tried is Elavil or amitriptyline.
I've heard of amitriptyline.
Okay. So that's a really good medication. It was originally utilized as an antidepressant. However, we've found that it has really good pain blocking properties as well. So it's really good in patients who have not only migraines, but other pain as well, just back pain and whatnot. But those two strategies in conjunction really seem to help a lot of migraine sufferers. And then lastly, and most importantly, I think, is the lifestyle.
Mm-hmm.
And that was kind of what we were talking about with the triggers, is finding your triggers, but also doing the things that can set you up for success. So getting enough sleep, making sure you're drinking enough water, and keeping a migraine diary so that like, oh, you know what, I ate that chocolate, this afternoon and it caused this,
Mm-hmm.
and it's always after I eat chocolate, I get a migraine.
Yeah.
So that really helps at the end of the day.
Just knowing your body. Basically.
That's right.
That's cool. So you may have said the term, but if you had, I didn't realize what it was. So what is neuromodulation?
Okay, so so these are getting into kind of the treatments, the different options that are available. So
Okay.
the ones that I had mentioned those are pretty standard around a lot. Primary care physicians really feel pretty comfortable prescribing those kind of medications. But when you get into like the neuromodulation and the CGRP and all these fancy terms, that's a little bit more specialty work. So neuromodulation. You've probably heard of it, like in a TENS unit. Have you?
I think I've heard. Yeah, I think so.
So people with musculoskeletal pain use TENS units, which is basically electromagnetic pulses that kind of stimulate the muscles, and it helps to reduce pain. And we've actually found that we can do the same thing in the migraine circuit. So one of the ones, there's a lot of different options, and it would take probably an hour to go through all of them.
Sure.
But one in particular that I really like and I personally use is called a cephaly. And that is a little device you put on your forehead, and it uses magnets and electricity basically to stimulate the same brainstem receptors to help to kind of reset the migraine.
Oh.
So yeah, it's
That's kinda cool.
It's really sci-fi, but it's pretty cool, and it really does work. We've seen that a lot of patients have reduction in pain, and you can actually have a prophylactic effect on this. So you can use it every single day to help reduce the number of migraines you get. So
Interesting. So you said it goes on the forehead. Is it like a headband kind of situation?
yeah, it's like a little sticker that goes on the forehead, and you just press it one time, and then it'll start the pulsing electric shocks. Now, that is something that is somewhat of a bottleneck for people because everyone has their own pain tolerance, so it's not super comfortable. So some people can't really tolerate it, but it is a really good option that's not a medicine.
I know Botox is kind of a big thing, right?
Yeah.
It's been a bigger thing lately, and I'm sure it's going to continue that trend. But people get injections all over their face and their forehead. Could that have any kind of play, or does that play into people having migraines?
There's actually an FDA approval for Botox in the prevention of migraines. So this would be under that bucket of prophylactic agents. And so this involves quite a few injections. So there's 31 total injections around the head and back and neck.
Okay.
So again, people, if you have an aversion to needles, it may not be the first choice.
Yeah, sure.
But it is a great option. The Botox itself has been shown to be able to block some of the pain pathways from the scalp, essentially back into the brainstem. Don't exactly know 100% how the science works behind it, but it works is ultimately the answer there.
Yeah.
And I've seen really good success if patients are really on time with their injections. So you have to get it once every 3 months.
Okay.
And it's really important to stick on that schedule because after 2 or 3 injections, you should start to notice that maximal benefit from both a reduction in total migraine frequency, but also how severe they are.
Yeah. So is it 31 injections every 3 months, or
Yes.
man, props to the people who like to do that, man. Wow. So is that
souls.
is that some sort of different Botox than what people would use for cosmetic purposes?
It's actually the same exact kind of Botox. There's a few different kind of formulations, but they are all used for the same thing, and it's the same Botox.
Wow, that's really cool. Really cool. Are migraines a potential indicator for any other underlying health issue?
Absolutely. So if you have new onset migraines or severe headaches, specifically if you have a headache that you would consider to be the worst of your life, you should seek emergent medical care, because essentially, if you've never had migraines or headaches before like this, and you're having a new pain that you're not used to, it could potentially suggest something underlying, such as a brain bleed or subarachnoid hemorrhage or intracranial bleed of some kind, and you really should seek emergent medical care. And a lot of times, those tend to be, they can be nothing.
Right.
They can also be something, and something that we need to address. If you're just starting to have migraines, maybe later on in life, over the age of 50, it's definitely worth, getting those looked at too, because a big cause of new onset headaches in older people is actually brain tumors. And
okay.
Yeah, so there's actually a list of kind of red flag headache symptoms, but I would say if you're having new headaches, you should probably bring it up at least to your primary care, and if they have enough concern, they can refer to a neurologist.
Yeah, for sure. Well, this has been really great. I had no idea there was so much involved, I guess, with a migraine. Again, not ever, to my knowledge, had one, and I knock on wood on that. But thanks so much for coming in today. I really appreciate it. And welcome to the area.
Thank you so much.
Jackson's a pretty cool town, I think. And so are you accepting new patients?
Yes, I am accepting new patients. So I should be able to schedule new patients sometime in September.
Awesome. And the phone number, I was looking it up, is 731-541-9490. That goes to West Tennessee Neuroscience. And if you're out there and you're having headaches and you've talked to your primary care physician and they're referring you, look no further than West Tennessee Neuro.
That's right.
Dr. Cameron Micahel, again, thanks so much for coming in today. This has been great. And this has been another episode of We Talk Health.